Oh, what did you do for Halloween?
I dressed up as Poison Ivy and had a few friends and family over.
Okay, that's cute. That's an original idea.
Thanks. What'd you dress up as?
I was Batgirl. I had a tutu and all that. It was kind of cute.
Oh, I was Betty Boo.
I bet that was real cute.
Good morning, ladies.
Good morning.
How are y'all doing today?
We're fine.
Good. How was y'all's weekend?
I had a blast.
Great.
Good. Do y'all have y'all's assignments for today yet?
Yes.
Okay. You want to tell me about it?
Sure. I have an 87-year-old female. She has osteoporosis, so we're going to make sure she can get up and ambulate and that she's not having any more problems than she already is.
Okay.
I have a 24-year-old patient. She has scoliosis. I'm going to assess her spine to check the severity of the scoliosis, and then we're going to do some gait exercises.
I have a 65-year-old patient. She just had knee replacement surgery. We're going to do some active range of motion exercises, and we're going to get her out of bed and show her how to use a walker.
Okay, now ladies, all of these situations are similar, even though they have different problems, and your assessment is going to be similar. You need to check their gait, their spine, and things like that. Caitlin and I are going to go ahead to her first patient, and you two can review physical assessment, okay?
Okay. Sounds good. Thank you.
All right. You need to look at her chart.
So I have an elderly patient who has osteoporosis. So we're going to check her gait, and we're going to make sure she can get up and ambulate and do her daily activities on her own.
Okay.
We're also going to check her spine to make sure she doesn't have too much of a hunch in case she would need surgery.
Okay. Sounds good. Let's go. All right.
I'm Kaylin. I'm going to be your student nurse for the day. This is my instructor.
Hello, I'm Valerie. Hi.
How you feeling?
I'm feeling okay.
All right, we're going to get you up and check you out and get you walking a little bit. Is that all right? Yeah. All right, I'm going to wash my hands.
Okay.
All right, I got on your chart here that you said you had osteoporosis. Is that right?
Yes.
How long have you had that?
Oh, about 10 years.
That ain't no good. All right, I'm just going to sit you up a little bit, okay? All right, you need help sitting up? Can you scoot to the edge of the bed for me?
Need my shoes. I got them.
Good job. Got that? All right. Can you stand up? Good job. All right, we're going to walk first and then we'll check. Okay? Just step this way just a little bit. All right. Now, can you bend over for me just a little bit and I'll check your spine. That's good. You can stand back up. All right. Let's sit back down. There you go. All right. Now, I'm going to put my hands on your shoulders. Is that okay? All right. And then you're just going to push up against my arms and lift yours. Okay? Ready? 1, 2, 3. Good job. All right, now we're going to do the same thing, but we're going to go out, okay? 1, 2, 3. Good. All right, we can go back down. All right, now we're going to do the same thing with the legs, okay? So we're going to lift this leg up. Ready? 1, 2, 3. Good job. Now do this one for me. Ready? 1, 2, 3. Good job, Miss Flowers. All right, I think we can get back in the bed. You want to take your shoes off? There you go. Put your covers back on. You want to lay down? Good?
That's
that's really good.
All right, now you call me if you need anything, okay?
I will, thank
All right, have a good day, honey.
you too, sweetie.
Thank you, Miss Flowers.
Okay.
So let's see where to start.
Alright, so 24-year-old female patient, scoliosis, like we discussed, we're gonna do the spine assessment and we're gonna practice some gait exercise.
Okay.
Alright.
All right.
Come in.
Hello, Mrs. Davis, how are you?
Hi, I'm fine. How are you?
My name is LaChevy Anderson, and I'll be your student nurse today, and this is my instructor.
Hi.
I'm Valerie.
So we're here to assess the severity of your scoliosis, but before we get started, I'm gonna wash my hands.
Okay.
So how has your day been?
It's been good. I've just been a little bit uncomfortable.
Okay, any pain?
No, not really pain, just uncomfortable.
Okay. Well, the first thing we're gonna do is, like I said, we're gonna assess your spinal cord to check the severity of the scoliosis, and then we're gonna practice a few gait exercises.
Okay.
All right, so I'm gonna get you up out of bed here. Are you able to get up on your own, or do you need assistance?
Yeah. I can get up.
Well, you look like you need a little. It's okay if I touch you, right?
Yeah.
All right, just turn your legs a little bit. All right, can you stand?
Yeah, I can.
Okay, if you could just touch your toes for me. All right. Do you feel any pain?
A little, not that much.
On a scale of 1 to 10.
About a 2.
Okay, okay. So you can look back up and have a seat. And I'll explain to you a couple of the exercises we're going to do. Right now, we just want to see if you have any kind of pain while you're walking. So if you could stand here,
Okay.
and if you could just walk to the sink and back, and I'm going to walk beside you. Any pain?
A little bit.
The same area? You can turn around for me. All right, that's good. You can have a seat. What we're going to do, we're going to chart these findings that we have here and give them to the doctor, and we'll see what the next step is that he wants us to take for you.
Okay.
All right.
Just 1 second. Now, Chevy, can you tell me what her diagnosis is, her medical diagnosis? Did you know by feeling her spine?
I did, because there's a little curvature in her spine. So that, alarms me that there is something going on with the spine.
Right, and that's what you've previously been diagnosed with, correct?
Yes.
Okay, good job.
All right, well, you can get back in bed. All right. Do you need anything?
Just some water. It'll be fine.
Grab that for you. Make sure that the bed is locked. Well, is it comfortable?
Yeah,
At this
it is.
specific angle? Okay. Well, we'll be back in a minute, and I'll bring back water.
Okay, thank
All
you.
right, you're welcome.
Come on in, I reckon.
Hi, Miss Anderson. My name's Karina Zimmerman. I'm going to be your student nurse today. Do you mind if I take a look at your arm, ma'am? Can you tell me your name, please?
You don't need for you, ain't it?
Yep. Can you just please tell me your name?
LaChevy Anderson.
Okay, that's perfect. I'm going to wash my hands. Do you mind?
Take your time.
And I'm her instructor, Valerie. Nice to meet you.
Okay, today, Miss Anderson, we're going to get you up, get you moving around a little bit to keep any swelling down on your knee and to keep the blood circulating. Is that okay?
Every time I get comfortable, somebody coming in here doing something.
Oh,
I
I'm
guess you gotta
sorry.
do what you gotta do.
I'm sorry. Do you need help sitting up?
I reckon I can do something. You know what you're doing, right?
Yes, ma'am. Okay, let me get this rail down for you. Okay, can you swing your legs on the other side of the bed for me? Now, do you mind just sitting here for a second? Are you
That's
okay?
fine.
I'm going to demonstrate how to use this walker.
Okay. I don't think it's too hard, but if you gotta show me.
Okay. So what we will do, we will make the walker, and then we will step like this.
With which foot?
With your foot, your leg that is not injured.
Okay.
Yeah. You think you can manage?
I mean, it don't look that hard to do, honey.
Okay. Need help?
I got it. Is it like this here, baby?
Yes, ma'am. Very good.
Okay. What do you need me to do now?
We're gonna just circle around and go back to the bed.
Do like this here?
Yes, that's perfect.
All right. It ain't so bad.
Now remember, we're gonna be doing this periodically throughout today to help with keep any swelling down and the blood circulating through your knee.
Okay, I think I need a little break right now.
Okay, that's fine. We'll get you back situated. Our goal is for you to make it to the end of the hallway by today, but we'll come back. We'll let you rest and come back.
All right, the last girl said she was gonna let me rest, and then you come. Well, okay, baby.
I'll let you rest. You want me to put your head down?
No, I'm good just like this.
All right. Thank you, Miss Anderson. Call me if you need anything.
If you can bring me one of them meals, them ginger ales, I'll be all right.
Okay. Yes, ma'am.
Rest,
Take a
baby.
few steps for me. Doing great.
Is this how you supposed to go right here?
Yes, ma'am.
Well, what can I do when I get home to keep, my walking going and everything?
Well, you can join a dance class. You can do some group exercises. You can go walking. Any of those things.
Okay, think I got it.
You got it? I'll let you do a few steps on your own.
All right.
Miss Anderson, wait!
How was today?
It was pretty cool.
It was good. Any problems? Any questions?
My patient was a little hostile today, but we worked through it.
Well, good. Overall, y'all did very well from what I observed. The only thing that I'm going to say is that Michelle and Kaylin did not check your patient's armbands when you went in.
Yeah.
And I knew you called it later on. You said something to me about it later, but you have to remember to do that.
Right.
Do y'all want to tell me about your findings when you assessed your patient?
Well, my patient, she had the scoliosis. She was pretty healthy. She was pretty aware of her condition and everything that went with it. And we didn't find any more abnormalities as far as what was already going on. So I think she's pretty going to be able to cope with it once she gets
What about pain? Did she have any pain?
It was minimal. She said about a 2, sometimes a 5, but she was used to, dealing with that.
Okay.
My patient was alert. She was aware of her condition. She said she knew that she had these issues. It didn't seem to be any worse than it had been in previous visits. She didn't have any pain. She was just a little stiff, as is expected. She moved pretty well. She had little issues with her abduction or adduction just from being weak, but I think she'll be okay. She just needs to monitor her diet.
Was she able to perform those
She was able
exercises?
to perform everything that I asked her to do. It's just a little more difficult on her legs than it was on her arms.
Okay.
My patient was overall healthy. She was a little annoyed that we kept having to come in and check her vitals or help her walk. So I let her lay down and rest for a little bit and came back and we did our daily check. We walked down the hall.
So she did
great.
complete her goal?
She did great.
Good. Okay, I'm glad to hear y'all had a good day. And we will meet back here tomorrow.
Okay.
All right,
Sounds
thank you.
great.
Oh, ligaments, cells, everywhere. Oh, ligaments in your bones.
Ligaments of what? Yo, ligaments! Cartilage!
What about
bones.
Ligaments, bones, cells. Almost time, almost over. Like this, step, wobble like that. My bones, muscle joints, stop me bringing on back. Back like this, stop it like that. If it weren't for your bones, you would dance with you whack. Said it green like this, wobble like that. My bones, muscle joints, let me bring it on back. Back it like this, stop it like that. If it weren't for your bones, you would dance with you whack. Ligaments, muscles, bones, don't you know?
Thinking of our skeletal system. It's a must we get down to business. Let's get gifted. We were given 206. BONES, that's a number, now remember it. Our skeletal system is a jack of all trades. They handle many functions, including keeping us fit. Bet you never knew that our bones can help produce little red blood cells inside their inner tube. Let's break the system down, let's put them on separate plates. First we got the skull, ribs, and vertebrae. This protects the organs and supports the body weight. The axial skeleton is its proper name. On the second plate comes the appendicular bones. This lets us move around, no couch potatoes. Got your shoulder and your arms, legs, and pelvis too. These appendicular bones take care of the pelvis too.
Lean like this, say wobble like that. My bones, muscle joints, let me bring it on back. Clap like this, say stop it like that. For one of your bones, and this dance will be whack. Lean like this, say wobble like that. My bones, muscle joints, let me bring it on back. Clap like this, stop it like that. If it weren't for your bones, and this dance will be whack. Ligaments, muscles, bones, don't you know?
Hey everybody, this is just a little bit of what it took to actually get here. You better enjoy it and appreciate it. Bye, Felicia.
Your old patient, she has osteoporosis. So we're trying to make sure that her treatment's going well and I'm sorry.
Recording now, stop.
So what did you file when?
You just went to a bar. I was supposed to say that.
Hello? Alright, so are you able to sit up at all any on your own, or do you need a little bit of help?
A little bit of help.
Okay, I'm going to put these side rails down, because we're going to also practice some gait exercises.
Okay.
Alright, if you could just lean slightly forward for me. Alright, that feel alright?
Mm-hmm.
Okay, and I'm just going to feel your spine. And you are okay with me touching me, right? Alright, do you feel any soreness or anything?
Yeah, a little bit.
That's all, folks.